Poziotinib is an oral exon 20 insertion TKI, which is currently being studied in non-small cell lung cancer for EGFR and HER2 exon 20 insertion patients. This is a rather specific group of patients with poor prognosis. The regular EGFR TKIs that are available at this moment are not effective in this particular mutation. That's where Poziotinib is being studied. So it's a large international Phase II trial with multiple cohorts, and I presented the results from cohort 1 and cohort 2, and those are both previously treated patients. Cohort 1 is for EGFR and cohort 2 for HER2 exon 20 insertions. In both cohorts, the tests for these mutations were done locally. Patients received 16 milligrams of Poziotinib once a day, and primary outcome was overall response rate. And the lower bound of the 95 confidence interval was 17%. So what we saw in this study group was that for the HER2 cohort, the primary endpoint was met. The response rate was 27.8. Therefore, the primary endpoint was met with a disease control rate of 70%. So, and most patients in that study showed a tumor size reduction. For the cohort 1, so the EGFR exon 20, the primary endpoint was not met, with a response rate of 14.8%. And while this primary endpoint was not met, still the disease control rate was high, with 68% disease control rate, and also a majority of patients showing a tumor size reduction. So still the drug is clinically active in these patients. We tend to see grade 3 treatment-related adverse events in about a quarter of patients, diarrhea and rash. This is one of the things that we're looking in at this moment to see whether an alternative treatment schedule can cause less side effects, and the preliminary data from the 5th cohort that is randomizing different treatment schedules already showed that a bi-daily schedule of 8 milligrams 2 times a day causes less side effects, and hopefully the treatment adherence will be higher, so that more patients can tolerate the Poziotinib better.